Welcome back. There is no doubt that COVID-19 has disrupted our lives. In fact, the Gauteng City Region Observatory's Quality of Life Survey reveals over a third of households in the province are living below the poverty line. For more on this, I'm now joined by Graham Gotts, Director of Research at Gauteng City Region Observatory. Graham, thanks for your time. So the findings are scary but pretty believable given the times we live in. You say a third of households are living under the poverty line. Just how many people are we talking about?
Yeah, so let me just quickly tell you what this data is based on. Every 2 years, the Gauteng City Region Observatory runs a big quality of life survey. And it's a survey that this time around in 2020-21, the data collection finished at the end of May of 2021, interviewed 13,600 people across Gauteng. And it's an adult-based household survey, so we're talking about adults. And it asked a whole bunch of different questions, about 200 questions across a whole range of different fields, which we can talk about. But one of the key things it does ask about is socioeconomic circumstances, and it's very, very clear that a lot of people have been knocked by the last year. And so we saw poverty levels gradually improve over the last couple of times that we've run the survey. The last time was in 2017-18, and there 24% of people were below the poverty line. This time around, it's kicked up all the way to a third, 36% are living below the poverty line. I'll have to do some quick mental gymnastics to say how many people that is, but it's a good 5 or 6 million people.
Yeah, that's pretty worrying, right? So we mentioned below the poverty line. What exactly does that mean?
Well, let me talk about some of the circumstances that people are in at this point in time. And of course, we know the story. I mean, it's there in the media, it's there in the public discourse in general terms. But what this survey really does is it gives you some look into the details of what's happening. So we're looking at a situation where 30% of our respondents, adult respondents in Gauteng, have seen salary and working hours reduced since March of 2020. That's a third of all adults. More scarily still is that nearly a fifth, 18%, have lost a job. So 18% have lost a job. And 10% of those who this is applicable to had to permanently close a business. And there's been various other economic effects which we can go into more detail around. Yeah. So this is what sits behind that poverty figure. And so what you're really seeing is an incredibly distressed socioeconomic context, which is manifesting in increasing hunger, which is manifesting in increasing depression, and is having cascading effects across a whole lot of dimensions of how people feel about themselves in the world and people's attitudes towards government.
Yeah, so just for context for our viewers, people who roughly make around 561 Rand a month available for food is below the poverty line, according to some of the research I'm seeing. So you also explored the quality of life for Gauteng residents in different themes, as you mentioned. Outside of the pandemic and the job losses, which we've seen through Stats SA as well, you looked at transport, poverty, inequality, and social mobility, as well as hunger and food security. Just take us through some of the finer details in those themes that you looked at.
Sure. So very quickly, what we're seeing is a situation where last time around, when we ran the survey in 2017-18, about 8% of our sample sat in the lowest income bracket of 1 to 800 Rand per household per month. This time around, 16% of our respondents are sitting in that low income bracket. And basically what's happened there is that people have been pushed out of income brackets above that, down back into poverty. And so what we're seeing, we think we're seeing in the data is a lot of people who were previously clinging tenuously to the middle rungs of the social mobility ladder have basically lost their footing and are now really struggling. And as we say, that's manifesting in things like hunger. We've seen an increase in the number of respondents in households reporting that they have had adults in the household skip meals. So it was 21% last time around, now it's 25%. We've seen a situation where about 52% of households are not spending enough on food to meet the cost of a basic nutritional basket of food. And that's really, really scary.
And then also something new that you looked into, I see, is experiences of violence and safety. If the crime stats are anything to go by, I have a feeling that it's not going to be good as well.
Yeah, so this is one of the really scary pictures emerging from the survey. Of course, this is a little bit decontextualized because we don't have comparative data on this particular area of violence. This is the first time around we've asked these questions, and we've asked it in a very particular way. Usually in a quality of life survey, you'd see a field worker sitting in front of a respondent and asking the question. And often that's a very difficult context for a respondent. They don't want to reveal sensitive information. So this time around, we got the respondents to fill in a self-complete section of the questionnaire, and about 87% of respondents agreed to do that. And they answered a whole bunch of questions on different aspects of violence. So abuse that they suffered as children, adult trauma in the last year, rape, and intimate partner violence. And just some of the headline figures, and it really is scary. 66% of all respondents suffered some kind of abuse, physical abuse or sexual abuse as children. That's mostly driven by physical abuse, being beaten by a stick, a belt, or other hard object. And really scary is the fact that 16% of our sample, nearly a fifth, experienced some kind of physical trauma in the last year, such as being threatened or hurt by a weapon. And so on. And it goes up depending on the gender and the age group. So staggeringly, 31%, nearly a third of adult males aged 18 to 24 experienced some kind of physical trauma in the last year.
And it'll be interesting to find out more on this one, quality of health, because of the pandemic. What are you seeing?
Yeah, so there's a whole bunch of data in the survey on health and health access. We were particularly interested to ask questions around whether people had COVID in their household. Interestingly, about 2.7% of respondents said that had at least one member of their household testing positive for COVID since March of 2020. Now, that figure looks very low, but if you extrapolate it out by the number of households in the province and the number of people on average in each household, it gets very close to the 450,000 infections that we know from the official records at the end of May 2021, which is when the survey ended. But that's only half the story. We're seeing lots of evidence in the data that people try to go and test for COVID, but we refuse. So another 2.2% made their way to a clinic or some kind of testing station, but weren't able to access tests. And we think that means that there's a significant undercount of COVID because of that. And then we asked about whether people struggle to access healthcare in the last year. And very worryingly, 7% in total of respondents said they struggle to access healthcare in the last year. And it goes up for certain population groups and certain income groups. Lower income people, 11%, couldn't access healthcare in the last year. And by comparison, those in the highest income brackets, it's less than 1%. So really what we're looking at is a situation where we certainly couldn't say that the health system has failed people in COVID, but certainly there's signs of worry that people who might be struggling with COVID or COVID-related conditions or have struggled to access healthcare in the face of COVID are obviously in dire straits.
That's very sad to hear, especially when we have a government that continues to say no one will be turned away when they seek medical assistance. We're going to have to leave it right there. Thank you so much for your time. Graham Gotts, Director of Research at Gauteng City Region Observatory.